Hello, my name is Aleena Alkwadri. I'm in eighth grade and I'm attending Al Huda Islamic School. My science for this year is about early detection of late onset type 1 diabetes mellitus. Last summer, I almost lost my life due to late diagnosis of type 1 diabetes mellitus. I spent 2 days in the pediatric intensive care unit and a total of 5 days in the hospital because of diabetic ketoacidosis. In an effort to make sure that what happened to me does not happen to anyone else, I conducted my science fair this year about the most common symptoms of type 1 diabetes. I created a screening sheet for pediatricians to use during well-child visits to identify and diagnose type 1 diabetes earlier. Some risk factors that can raise your risk for type 1 diabetes include family history, genetics, geography, and the most important one being age. Type 1 diabetes can appear in any age but is most noticeable at two peaks. The first peak being in the ages 4 to 7, and the second one being in the age 10 to 14. To conduct my experiment, I created a survey using Google Forms that first asked for parental permission, then asked if this child is willing to take the survey, and then asked if they are between the ages 12 to 15 and have a medical diagnosis of type 1 diabetes. The last question was about the most common symptoms that the child experienced before their diagnosis. Moving on to this graph, you can see the number of subjects that have reported for each symptom. 15 chose that they urinated a lot and felt more thirsty than usual. 12 felt very tired and weak. 11 had dry mouth. 8 felt irritable and had other mood changes, as well as lost weight without trying. 7 felt very hungry and craved for orange juice, and 1 had blurry vision. After all the surveys were received, I calculated the percentages for diabetes mellitus and the symptoms occurrence from all the surveys I've received. 93% of the subjects reported increased thirst and increased frequency of urination. 75% reported feeling tired and weak. 68% of the subjects reported dry mouth. 50% of the subjects felt that they lost weight without trying and had irritable and other mood changes. 43% of the subjects reported feeling very hungry and craved for orange juice, and 6% had blurry vision. In conclusion, after all the surveys were analyzed, I was able to draw a conclusion that the most common symptom of type 1 diabetes in children ages 12 to 15 were excessive thirst, frequent urination, feeling very tired and fatigued, and dry mouth. I created the table below to suggest adding it to annual well-child visits for the ages 10 through 14. I would also recommend to doctors that they measure the children's A1C levels at any age, 10, 12, and 14, regardless of weight or body mass index. The diabetes screening sheet below asks a few questions that they could add to the well-child screening sheet. To follow up on my research, I would like to have a larger sampler size. I would also like to implement the screening at doctors' offices and follow up to see how many diabetes diagnoses were caught early in children without a clear risk for developing this disease.